Reference ranges for blood tests. Reference ranges for blood tests are sets of values used by a health professional to interpret a set of medical test results from blood samples. Reference ranges for blood tests are studied within the field of clinical chemistry, also known as clinical biochemistry, chemical pathology, or pure blood chemistry, the area of pathology that is generally concerned with analysis of bodily fluids. Blood test results should always be interpreted using the reference range provided by the laboratory that performed the test. Interpretation. A reference range is usually defined as the set of values 95% of the normal population falls within, that is 95% prediction interval. It is determined by collecting data from vast numbers of laboratory tests. Plasma or whole blood. In this article, all values except the ones listed below denote blood plasma concentration, which is approximately 60–100% larger than the actual blood concentration if the amount inside red blood cells RBC is negligible. The precise factor depends on hematocrit as well as amount inside RBC. Exceptions are mainly those values that denote total blood concentration, and in this article they are all values in hematology red blood cells except hemoglobin in plasma, all values in hematology white blood cells, platelet count PLT. A few values are for inside red blood cells only. Vitamin B9 folic acid/folate in red blood cells, mean corpuscular hemoglobin concentration MIC. Units. Mass concentration G/dL or G/L is the most common measurement unit in the United States. Is usually given with dL deciliters as the denominator in the United States, and usually with L liters in, for example, Sweden. Molar concentration mol/L is used to a higher degree in most of the rest of the world, including the United Kingdom and other parts of Europe and Australia and New Zealand. International units IU are based on measured biological activity or effect, or for some substances, a specified equivalent mass. Enzyme activity CAT is commonly used for e.g. liver function tests like AST, ALT, LD, and GGT in Sweden. Percentages and time-dependent units mol/S are used for calculated derived parameters, e.g. for beta cell function in homeostasis model assessment, or thyroid's secretory capacity. Arterial or venous. If not otherwise specified, a reference range for a blood test is generally the venous range, as the standard process of obtaining a sample is by venipuncture. An exception is for acid base and blood gases, which are generally given for arterial blood. Still, the blood values are approximately equal between the arterial and venous sides for most substances, with the exception of acid-base, blood gases, and drugs used in therapeutic drug monitoring (TDM) assays. Arterial levels for drugs are generally higher than venous levels because of extraction while passing through tissues. Usual or optimal. Reference ranges are usually given as what are the usual or normal values found in the population, more specifically the prediction interval that 95% of the population fall into. This may also be called standard range. In contrast, optimal health range or therapeutic target is a reference range or limit that is based on concentrations or levels that are associated with optimal health or minimal risk of related complications and diseases. For most substances presented, the optimal levels are the ones normally found in the population as well. More specifically, optimal levels are generally close to a central tendency of the values found in the population. However, usual and optimal levels may differ substantially, most notably among vitamins and blood lipids, so these tables give limits on both standard and optimal or target ranges. In addition, some values, including troponin I and brain natriuretic peptide, are given as the estimated appropriate cutoffs. Variability. References range may vary with age, sex, race, pregnancy, diet, use of prescribed or herbal drugs, and stress. Reference ranges often depend on the analytical method used, for reasons such as inaccuracy, lack of standardization, lack of certified reference material, and differing antibody reactivity. Also, reference ranges may be inaccurate when the reference groups used to establish the ranges are small. Sorted by concentration. By units. Units do not necessarily imply anything about molarity or mass. A few substances are below this main interval, e.g., thyroid-stimulating hormone, being measured in mu/L or above, like rheumatoid factor and C-alanine-9, being measured in U/mL. By enzyme activity. White blood cells. Sorted by category. Ions and trace metals. Included here are also related binding proteins like ferritin and transferrin for iron and ceruloplasmin for copper. Note, although mEq for mass and mEq/L are sometimes used in the United States and elsewhere, they are not part of C and are now considered redundant. Acid base and blood gases. If arterial/venous is not specified for an acid base or blood gas value, then it generally refers to arterial and not venous, which otherwise is standard for other blood tests. Acid base and blood gases are among the few blood constituents that exhibit substantial difference between arterial and venous values. Still, pH, bicarbonate, and base excess show a high level of inter-method reliability between arterial and venous tests, so arterial and venous values are roughly equivalent for these. Liver function. Cardiac tests. Lipids. Tumor markers. Endocrinology. Thyroid hormones. Sex hormones. The diagrams below take intercycle and interwoman variability into account in displaying reference ranges for estradiol, progesterone, FSH, and LH. Other hormones. Vitamins, also including the vitamin B12-related amino acid homocysteine. Toxins. Hematology. Red blood cells. These values, except hemoglobin in plasma, are for total blood and not only blood plasma. White blood cells. These values are for total blood and not only blood plasma. Coagulation. Immunology. Acute phase proteins. Acute phase proteins are markers of inflammation. Isotypes of antibodies. Autoantibodies. Autoantibodies are usually absent or very low, so instead of being given in standard reference ranges, the values usually denote where they are said to be present or whether the test is a positive test. There may also be an equivocal interval, where it is uncertain whether there is a significantly increased level. Other immunology. Other enzymes and proteins. Other electrolytes and metabolites. Electrolytes and metabolites. For iron and copper, some related proteins are also included. Medication. Medication